Please start, Sneha. Unmute yourself and start.
Yes, ma'am. A very refreshing good morning, everyone. I, Sneha Bhardwaj, welcome you all in the capacity of HR Speaking Cube. Today we will have lecture of psychology, psychiatry, and mindfulness expert. So stay tuned with us to declutter your mind. I now invite our first speaker, Dr. Rajkiran Dontu. He's from Department of Psychiatry, NRI Academy of Sciences, Mangapuri, Guntur, Andhra Pradesh. Sir will enlighten us on the topic of psychiatric illness and childhood trauma. Over to you, sir.
Thank you. Uh, I'm really happy being here. First of all, I would like to thank Speaking Cube, Deepika ma'am for inviting me. And then also giving me the topic which is very relevant to me. I think there is something problem with the voice. Voice is getting echoed. Uh, is everything okay for everyone?
Yes, there is
okay.
echo
Now
in
it's
the
fine.
sound. There is echo
It is
in the
good.
sound.
But I'm not able to hear any echo.
Now it is
Your
fine.
voice is,
But when Dr. Dontu is speaking, it was there.
Now it is fine, Dr. Dontu.
your voice is very clear.
Dr. Dontu, have you joined with two device? There is Sneha, your voice was also going.
Shall I share and see, ma'am?
Yes, yes, you are clear now. Please go ahead. I think it can be the internet issue as well.
Okay. So, is my presentation visible?
Yes.
Okay. Thank you all. So this topic is very relevant from my
No, I think no. Your screen is visible, I think. You have shared your screen.
Yes, ma'am.
Uh, presentation is not visible. You can go to window and share presentation. Share button and then window and then presentation.
Now, ma'am.
Yes.
Okay. So what happens is that daily we tend to see a lot of cases on psychiatric illnesses, and in some of the cases, it becomes very clear that they do not fit into that normal pattern. So that is when we go back and then we start realizing that something has gone wrong in the childhood. So when we tend to evaluate, we understand that there is some kind of a childhood trauma which had taken place. So in that context, this talk is very relevant. Now, what I'll be covering is, since the time allotted is less, I'll try to stick on to the point. So I'll try to describe the psychiatric illnesses where there is a good amount of evidence linking it with the childhood trauma. What I'll not be covering is some of the basics of childhood trauma, different types, and most important is neurobiological aspects. So there are a lot of neurobiological aspects which have been uh, linked with childhood trauma, and that has link with the psychiatric disorders. So starting with that, trauma exposure during childhood or adolescence is associated with deleterious mental health outcomes. Now, I start my presentation with such huge words because the presentation itself is different. Yesterday also I had seen a case where the presentation looked more of psychosis, but then when we tried to evaluate, there was a lot of childhood trauma. So exposure to any form of childhood trauma can lead to recurrent and chronic mental health condition. This is very important. So this does not fit into that normal pattern what we see in the psychiatric disorders. Among the consequences of childhood trauma, many are biologically based. Exposure to multiple forms of maltreatment is linked with greater than threefold increase in odds of mental illness. Now, when I say biological link, there are a lot of people who had done a good amount of work in trying to understand the biological correlates with the psychiatric disorders. Among the one which I more, whom I had learned more is Bruce Perry. Now, he is a child psychiatrist who had seen a lot of this cases of childhood trauma and their presentation. That is when he understood that there are a lot of biological things which are going place, and then he had developed something called neurosequential treatment. So that is not a part of my presentation, no? Just to help you understand that the biological correlates are a huge thing. So most of the research has not distinguished.
No, Dontu, is your are you moving your presentation from your side?
Yes, ma'am.
It is not getting. I think it is
Now,
stuck to one side. Now, yes.
now it is
Yes,
moving, ma'am.
yes. Now it is moving.
Okay.
Thank you.
Most of the research has not. Okay. A number of possible mechanisms explain the relationship between the childhood trauma and adult mental illness. Most theories focus on stress-induced neurodevelopmental changes, and in studies involving adults, childhood trauma is measured retrospectively. So hence there is a possibility of bias. So most of our studies, we need to look into that from where they are getting the sample and all those things. Now, just a brief slide on the possible mechanisms. Now, there are a lot of mechanisms. One few of these which are very relevant are exposure to trauma leads to dysregulation of hormones and dysregulation of hypothalamo pituitary axis. So that in turn leads on to how we handle the stress. Now, adult women with the childhood abuse, that leads to persistent sensitization of autonomic stress response. That in turn leads to mental health vulnerable to stress. There is a greater risk of future psychiatric illnesses. There are psychological theories also. One which I had come across is exposure to childhood trauma affects child's cognitive schema of themselves, people around them, and the world. So there is a vulnerable to negative beliefs that affects how they feel about themselves and others. So childhood trauma is also found to induce alterations in gene promoters. So more into this molecular level of understanding. So that in turn has inverse correlation with the gene expression. So moving on to each individual disorder, depression, of course, everybody is aware of, and it is also the most common adult psychopathology following childhood trauma. So early adversity accounts for 50%, 54% risk of current depression. Childhood trauma in turn increases the odds ratio of having depression to around 13.7. Now, a study looked into whether reducing maltreatment, how much the depression or anxiety can be reduced. So they found that 10 to 25% reduction in maltreatment can almost prevent 31 to 80 million cases of depression and anxiety worldwide. So that's a huge amount, and that shows the amount of impact which it can have. Now, little bit about the clinical presentations. So childhood trauma with depression. So what kind of clinical picture we can have? illness severity can be severe. There is increased risk of suicide. Earlier age at the onset of the disease, more number of depressive episodes. Even among the particular depressive episode, the clinical presentation may vary. For example, they can have hypersomnia. Usually in depression, we'll have insomnia. They can have more of interpersonal rejection sensitivity, increased appetite. Normally in depression, we'll have decreased appetite, lead and limb paralysis. They can have a chronic presentation. So the chronic is again not very well defined in our literature, but then they say that prolonged periods of depression not responding to the treatment, poor response to the pharmacotherapy. So as I mentioned, chronicity from one of the studies which I found is individual being depressed for at least 24 months or more in the past 4 years. Coming into the gender and type of trauma. So some studies have found that maltreatment increases the risk of depression in both males and females, but there is some disparity. Some studies have found females are more vulnerable when compared to male. Again, types of trauma, this is little confusing because most of the studies, they have not tried to differentiate between the type of trauma and the link with the depression. Some have found out that physical abuse is more related than when compared to the emotional abuse and neglect. Psychological and biological consequences of depression or neglect differ substantially from threat or abuse. More types of trauma and severity, there is significant predictor for depression severity. Timing of trauma. So when we came to know that trauma is associated with psychiatric illness, they wanted to know at what timing or when the child is exposed to the trauma has an impact. So that is what they named it as window of vulnerability. So there are periods of development during the childhood where if trauma occurs, there is more likely that in the adult or in the adolescence, they can have a psychiatric illness or mental health issues. So these window of vulnerability in the childhood is somewhere around 3 to 6 years in case of depression. Now, why that specific age group or why that specific window? This is because during the childhood, the brain keeps developing. Now, even when just soon after the birth, you have a lot of neurons or the brain is completely with neurons. But then as the child progresses, what happens is that the brain starts getting altered. There are some parts of the brain which develop. There are some parts of the brain which, they are removed of what we call it as synaptic pruning. Now, these changes takes place during this time. So when there is a trauma occurring during this time, what happens is that the normal development of the brain doesn't take place, and then that leads on to a abnormal type of development. Now, the areas are also the studies are also looked into specific areas which are involved when this kind of a trauma occur to the development brain. So the areas which are affected are prefrontal cortex, amygdala, and hypothalamus. Now we are all aware that these are the areas which are very much linked with our emotions, our mood changes, and all those things. So you can automatically link that. Okay, there is a trauma; these parts are affected, and in the future that affects the mental health issues. Now, depressive episode in adolescents occur within 1 year of exposure. Now, this is during the adolescence presentation during the adolescence. So, during the adolescence, within 1 year of exposure, there is a more likely of having a depressive episode. Now, when we come to the response to treatment, so in my previous slide, I already mentioned the treatment response with the pharmacotherapy is little less. So, what happens? Depression and childhood trauma less likely to remit and have more episodes. So they are 1.6 times less likely over 8 weeks of treatment to benefit from a typical first line antidote. Now, what we say as response is usually when we start on antidepressant or pharmacotherapy, usually they start responding within 4 weeks to 6 weeks. Now, when there is no response during this time, we say that the response is taking a longer time. So at that point of time, we need to say, okay, there is something else. Now, trauma-focused cognitive behavior therapy, again, there is a good amount of research saying that this addresses negative impact and that can help the patients to come out of it. Moving on to bipolar disorder. Now, we are all aware that bipolar affective disorder, the patients are highly susceptible to life events. Any kind of a changes or any kind of a stressful situation, it can have either mania or depression. Again, there are a lot of correlates saying that what kind of a stress leads on to the what kind of either depression or mania. But then again, we are aware that stressful life events can cause uh, another episode. So patients, in this case, they retain the contact with the surrounding world and can be overwhelmed by their own sensitive life experiences. So uh, with this high susceptibility, if there is an underlying childhood trauma, so that again increases sensitivity and then increases the chances of having another episode. So early trauma is relevant in genesis and also the progression of the illness. So probably they can have more number of episodes, more frequency of episodes. So what we say it as rapid cycling, where there are at least 4 or more episodes in a year. So there are more chances that they can move towards rapid cycling. Then there is increased prevalence of childhood trauma impact on the clinical outcomes. So moving on to the clinical presentation, childhood trauma is a key determinant in expression in the course of bipolar disorder. Abuse and neglect specific risk factors associated with worse clinical outcome. Now, early childhood adversity, what it can cause, it influences more number of recurrences, more number of mood episodes. As I mentioned, rapid cycling pattern that is more than four or more episodes in a year, increased severity and a higher frequency of psychosis. So these are the things which we can see in cases of bipolar disorder. Now moving on to post-traumatic stress disorder. As you are all aware, three important things for us to make a diagnosis: re-experiencing the event in the here and now, deliberate avoidance of reminders of the event, persistent perceptions of heightened current rate. As the name itself says, and with the trauma, there is more association of PTSD. So prevalence is estimated to be 3% lifetime and reaches to 8 or more in some of the communities. Now, childhood trauma can influence PTSD in children. So PTSD can be a direct consequence of trauma. Trauma can also indirectly increase the risk of later developing PTSD. So again, altered psychobiology, that is neural, hormonal, and epigenetic factors can also play a significant role in leading on to the presentation. So childhood trauma with PTSD, there are lower performance scores in the cognitive domains. Victims of childhood trauma, there is a greater number of and more severe PTSD symptoms. So as the stress keeps coming and accumulating, the allostatic load also keeps increasing on the brain and body. So by increasing allostatic load, childhood trauma increases the risk of further dramatization and development of PTSD. Moving on to this anxiety disorders. Social anxiety disorder, childhood maltreatment in social anxiety disorder, there is greater severity and poorer function. So again, resilience and quality life also will get affected. Resilience is also again a positive factor, so that can affect the patient can to come out of it. So emotional neglect and abuse have more symptoms here. Multiple trauma types of trauma has a additive effects. Again, parenting rearing styles also have a significant impact on the presentation. So we are all aware. So again, overprotection, rejection, and lack of emotional warmth again leads on to onset of the disease. Obsessive compulsive disorder. Onset of OCD is often preceded by stressful life events. Even in our normal patients who come to us with symptoms of OCD, when we take a detailed history, we know that the current symptoms are come out because of some stressful events. For example, in a school going age, some exams are coming up, or in case of adults, some kind of a stressful situation that triggers the onset of the of OCD. So also the OCD symptoms increase under stressful situations, and the patients with OCD suffer daily life stresses more than the healthy individuals. So greater OCD symptoms are seen in women when compared to men. Important component is trauma severity rather than the type of trauma. So the more the severe, again, it has a direct correlation with the severity of the OC symptoms which they are presenting with. Psychosis. Now, before I go on to this, I would say that the evidence for the onset of psychosis is little less. But then again, more and more number of studies are looking into and trying to understand how this is happening. Probably the answer lies in more of the genetic things. Why I say the disclaimer is because for the disorders like depression, bipolar disorders, already it is very well established, or you can say that from the history itself, we can very clearly understand how it is going on. But for the psychosis is a little tough. So the presentation, when the patient is in the psychotic phase or during the psychotic episode, usually it becomes tough for us to try to understand what had happened in the past. So unless he comes out of the psychosis, he becomes fine and cognitively becomes better, it becomes difficult for us to understand. So evidence for an association with between childhood trauma and psychosis is steadily accumulating. Population-based studies suggest that childhood trauma is an important risk factor for psychosis. So that is there, but then how it is linked and how much it is linked, that is not is very clear. Studies have reported more psychotic patients with childhood trauma than controls, and history of abuse was related to psychotic symptoms and or the diagnosis of a psychotic disorder either during adolescence or adulthood. Clinical presentation. Children with maltreatment are more likely to report psychotic symptoms at 12 years. Again, this is a particular age where they found out more number of patients presenting with that. There is a cumulative effect of physical abuse and bullying during adolescence, leading on to greater risk for psychotic symptoms. Psychosis is related to traumatic events in a dose response fashion, with non-consensual sexual intercourse having a stronger association than non-contact sexual abuse. So again, these are different types of childhood trauma. Association between childhood sexual abuse and psychosis are also only present among women. Psychotic patients with childhood trauma have a more severe clinical profile compared with those without those experiences. As I was mentioning in the starting, I had seen a case where the presentation is little severe. It's not fitting into the normal pattern of cases which we see. So they report more substance abuse, higher level of current depression and anxiety, and more dissociative symptoms. Childhood sexual abuse has specifically been linked to hallucinations and delusions. The content of these positive symptoms may be related to patient's traumatic experiences. Treatment studies suggest trauma-specific treatments are as beneficial for patients with psychosis as for others. So psychotic patients with early and complex trauma can benefit from psychoeducation, stabilization, and development of safe coping skills. Now, these all we try once the patient is out of psychotic episode, and then he is able to, he has gained some insight into the symptoms. That is when we can do some of these things. There is some evidence for exposure-based intervention and that they are safe, effective in patients with psychosis. Now, I'm not very well aware of what exactly are the intricate details of these exposure-based interventions. And then there is a study where Muser et al. Developed an approach to treat PTSD in psychosis. So it included psychoeducation and breathing retraining with cognitive restructuring to address thoughts and beliefs related to trauma experiences and their consequences. Substance use disorders. There is a good amount of evidence linking childhood trauma with substance use disorders. Over 60% of individuals with SUDs were victims of childhood trauma. Heroin users were found to experience higher rates of childhood trauma, such as receiving injuries as a result of physical punishment, penetrative sexual abuse, emotional abuse, and physical neglect. Among the cannabis abusers, 34% of individuals with dependence have experienced childhood trauma. Gender. Females are more likely to experience a range of childhood trauma which continued over the age of 18 years. 70% of the patients with alcohol dependence have experienced at least one form of trauma in their childhood. Exposure to childhood trauma increases the risk of developing alcohol dependence 7 times. A huge amount of research has been conducted examining whether childhood trauma may be implicated in genesis, maintenance, and recurrence of SUDs. So this is where cases where we notice that even after a good amount of psychoeducation, good amount of using motivation enhancement training, they come back to the recurrence. So this is when we need to reevaluate and find out whether something has happened in the past or in the childhood. Good evidence that women with alcohol problems are much more likely than general population to have sexual abuse as children. Again, a lot of mechanisms. So childhood trauma that causes a cycle of distress where the individual learns maladaptive coping strategies and become less able to cope with ordinary situations. So these addictive behaviors among childhood trauma individuals have higher level of self-reported subsyndromal stress levels compared with controls. Chronic activation of stress response in turn increases the risk of psychopathology, including addiction to drugs and alcohol. High levels of stress and negatively impact recovery from opiate dependence by increasing cravings and polydrug abuse. We say polydrug abuse when the patient or the person uses at least 3 or more drugs. Early life stress has long-lasting effects on the mesolimbic dopamine pathway. This is one pathway which they have found out is much more affected in those people with childhood trauma and substance use. Variation within the dopamine pathway has significant implications for behavioral response to reward. So what they found out is that the experience of reward is slightly different in the patients who had childhood trauma during their childhood. So because their experience is different, so probably that makes them to migrate towards substance use. Enhancement of dopamine again mediates multiple effects of additive drugs such as behavioral and motor activation and the rewarding effects of the drugs. Clinical presentation impacts the severity, course, and duration of alcohol dependence. Childhood maltrauma uh, is linked with alcohol abuse at an early age and experience more severe abuse. Experiencing 2 or more adverse childhood events has also been correlated with lifetime alcohol dependence. Experiencing traumatic events before 11 years, again, window of vulnerability, which I'm mentioning, there is higher risk of using marijuana, cocaine, prescription drugs, and engaging in politics. Female sex abuse victims with interpersonal traumatic events have shown to use substances as a coping method. Emotional abuse associated with severity of drug use in alcohol dependent patients. Experience of emotional abuse in conjunction with sexual abuse or emotional neglect can intensify drug abuse problems. So screening for history of maltreatment in patients with SUDs who enter in psychotherapy is also very, very important. For treatment outcomes, higher level of childhood maltrauma, poorer treatment outcomes. Higher severity and frequency of childhood trauma, higher level of personality disorder, and an earlier age of entering into the substances. Increased severity of childhood trauma, there is severe psychiatric symptoms and more risky behavior. So treatment efficacy wise, alcohol dependent patients with childhood trauma benefited less from treatment and were more abstinent for shorter periods of time. So these are the clinical outcomes where we can expect in case of substance abuse with childhood trauma. Finally, I'd like to end with this small take-home message. So childhood trauma causes a lot of neurological changes, which in turn has implications on future illness severity and outcome. Now, whatever may be the disorder, it has an impact on the presentation, severity, as well as a course over a long duration. Most of the psychiatric illness, childhood trauma increase the likelihood of having comorbid illness. Having a thorough understanding of neurobiological changes can help in shaping the proper treatment modalities. So with this, I'll end my presentation. Uh,
Thank you so much, sir.
Thank you
Thank
so much,
you so
sir.
much
Thank you
for the wonderful
for wonderful
presentation.
presentation.
I'm sure everyone will gain something valuable from it. Now, I will invite our second guest speaker, Professor Dr. Anita Chauhan. She is an associate professor, head of the department Center of Psychology and Behavioral Sciences, Shuliri University, Solan. Ma'am will enlighten us on the topic psychological perspective of poor couple relationship. Over to you,
Thank
ma'am.
you, Thank you, Sneha. So, I am, first of all, I'm really thankful to you all to invite me for this talk. And please forgive me, my throat is not well, like it is bad today. So there might be a little disturbance because of it. So just a second, I will share my screen. Is my screen visible?
Yes, ma'am.
All right. So, so I'll be talking about psychological perspective of poor couple relationship. Poor couple relationship, it can have profound psychological impact on individuals involved. It can range from communication backgrounds to unresolved conflicts, and there are various factors that can lead to deterioration of a couple's bond. So today we will be exploring various psychological perspectives, and we'll be examining underlying mechanisms, common patterns, and potential interventions. So, what are the signs? What are the common signs that a relation that can indicate that whether a relationship is failing? So, the first can be arguing a lot, lack of physical intimacy, lack of emotional intimacy, lack of respect and regard for one another, spending little time together, no emotional connection, and loss of attraction, spending time with other people, feeling bored in the relationship, and distancing oneself from the partner. So, what makes a relationship difficult? So, there are various factors. First is individual differences. So, as Henry Dix has explained in his book Marital Tensions, he says that the experiences that an individual has in his childhood, that impacts the way he sees the world. So whenever a conflict occurs in a couple's relationship, they see that from their own lens, and this creates a different perspective for each other, and it can often lead to conflict between them. Second is implicit expectations. Um, as Jackson says, that there are certain indirect and implicit expectations that people have, which serve as a maladaptive way to deal with the problems that arise in the relationship, and this can deteriorate relationship between the two people. Third one is the relationship roles. Relationship roles, like in a relationship, people assume different kinds of roles that just to make the relationship work. For instance, they can play a role of a peacemaker, the clever one, or the victim, or the martyr, which is based, and oftentimes these roles that are played by people, they are based on person's poor self-esteem, and this can also deteriorate a relationship. Fourth one is the lack of differentiation. So according to Bowen, we develop patterns in relationship to reduce anxiety, but sometimes anxiety can occur in a relationship because of too much of closeness between the couple, or a great distance in the relationship. And also there is a notion that whenever people are in a romantic relationship, so there are two bodies in one soul. So this is also problematic, as there are two different people, and now they have to forget their individuality and become one. So this can cause anxiety because they would lose a sense of self in themselves, and then this can lead to relationship issues. Then resistance to change. So according to Halle, people in relationship, they are resistant to change. because the couple interactions mostly are based upon the dynamics of power and control. So at times, people like the relationship. It also depends upon how the partners function together. But the sometimes resistance to change can also lead to relationship issues. Then communication breakdown. If the communication patterns between the couple involve criticism, contempt, defensiveness, or stonewalling, then it can significantly impact the relationship dissatisfaction breakdown. And negative communication patterns have also been highlighted in various studies like Christensen and Hervey. And technology also it impacts negatively the relationship because the communication breakdown occurs during the time of conflict. And excessive use of social media, it also indicates relation dissatisfaction in relationship dissatisfaction in relationships, and also jealousy amongst the couples. And emotional intimacy has been possibly correlated with um, relationship quality. If it lacks, then it can deteriorate the relationship and also lead to dissatisfaction and distress. Then it also affects the emotional regulation amongst the people. If uh, there is a strained relationship amongst the couple, then it can lead to emotional dysregulation, which will impact the quality of their relationship. Then there are certain factors, external factors and stress that can lead to deterioration of the couple relationship, and it can lead to dissatisfaction such as financial strain, work related pressures, family conflicts, the and also it would also be impacted by the um, technology and the financial factors. And also, if the individual lacks in effective coping strategies, then the situation will get worse. Then the most important thing, what I feel, is the attachment styles. The attachment styles, there are various theories which have been proposed by various researchers like Bowlby, Hazen and Shriver, Bovenkamp et al. So they have emphasized the development of attachment style during the early childhood, like Bowlby and Harlow. So they say that the individuals in the early stage, they develop the relationship with the caregivers, and that would influence their adult relationships. Then it was in adults, Hazen and Shriver, they have explained various kinds of relationship styles that can impact the couple's dynamics. So attachment is why is attachment necessary in a relationship? Because it gives um, the relationship stability, and it is an enduring bond between with a special person. It also provides security and safety, which includes soothing comfort and pleasure. So and if this attachment is lacking, then it can lead to distress. So as I just mentioned, that there are various attachment theories which posit that infants have innate drive to seek the attention and care of the primary caregivers, usually their mothers, for survival. But as they grow up, they form secure, and these attachment, they also form secure base for these children to explore the world around us. And if this attachment is disrupted, then it can lead to emotional insecurity in the adulthood. And then there are some like we as human beings, we are relying on attachment figures for protection and emotional regulation. Any kind of threat can be they can be
Mhm.
diminished if the attachment figures are quite strong.
Hello.
And
Ah.
their attachment adult attachment, it can if the childhood experiences we like from the childhood experiences, we have developed some schemas that are interconnected with dependability and others, and this can provide like how we see ourselves and how we feel that we are whether lovable or not. That would depend upon the attachment styles that we have developed in the childhood. So, according to Hazen and Trevor, there are four kinds of attachment styles. One is avoidant, fearful. In this, we tend to recognize the needs that we have, and but we avoid the others, which and frame them as untrustworthy. Then another kind of attachment style is avoidant dismissing, in which the individual tends to deny that there is need for attachment, and this person would frame others as untrustworthy. Then comes anxious and preoccupied. These people, they tend to cling to attachment figures, or they would aggressively demand reassurance at every moment, and then this would um, like they would these people would fear that something wrong is going to happen, and they would feel insecure and deficient and unlovable. Then fourth kind of attachment style is secure attachment. Secure attachment in this, people tend to believe that others are reliable, and they see themselves as lovable and worthy of care. So these attachment styles, why are they important? Because they offer us a framework through which we see ourselves, we see others, and we see the relationships around us. And also, they also predict the way we will respond to the situations. So, how does trauma occur in relationships? So, trauma in relationship can occur because of interpersonal conflict, which has been indicated by a recent study by Smith and Johnson, in which they highlight the impact of ongoing conflict in relationship um, on individuals' mental health. And they have also found high correlation between sustained conflict and the symptoms of trauma. Then second is attachment trauma. Attachment trauma, um, how uh, the child has had experience had negative experiences during his childhood that can impact his um, romantic relationship or adult relationships, which and the study by Thompson, it reveals that there are if there are these people will have difficulty in forming secure attachments and maintaining intimacy with people. Third is intimate partner violence. So another study, it indicates that trauma, if if a child has had trauma, so intimate partner violence, it has also found a significant relationship with trauma, and um, uh, they also emphasize on the need for comprehensive intervention to address both the trauma and the violence, because it can also be dated back to the childhood experiences that people have had. Then betrayal trauma in this, if a person is betrayed, then it can affect the relationship, and these people can have this can lead to profound trust issues and emotional distress. It can be emotionally distressing for the survivors. Then how does many trauma manifest in relationships? So first is the trust issues. The people who have experienced trauma in their life, they would never be able to trust uh, uh, people, and they would have trust issues in their intimate relationships. Then these people will also be emotionally dysregulated, and they would not be able to regulate their emotions effectively, which will lead to relationship difficulties. And they would also avoid and withdraw from social settings, from the relationship, and they would never be able to communicate and form healthy connection with their partners. Then communication channels challenges. Communication challenges would also be there because these people will never be able to express their needs and boundaries to others, which will also affect the relationship negatively. So now in this section, we will be discussing the role of genetics, other factors than attachment, like the role of genetics, spirituality, and karma, and how can these things help in the management of relationship traumas. So first is genetic influences. So as we all know that the genetics, it play an important role in shaping our personality, our predispositions, and even our vulnerabilities. And understanding these influences, it can be empowering to us and allowing us to acknowledge our inherent strengths and weaknesses so that we can deal with um, our life issues, and also it can lead to personal growth. Genetic predispositions, they play an important role in shaping responses and adversity, which has been highlighted by a work of Caspi et al. In 2003, in which they emphasized on gene-environment interaction and how um, trauma, how it can be related with trauma, susceptibility to trauma. In another study by Duncan et al., it focused on epigenetic modification, which tells us, which gives us an insight into how um, gene and environment they can interact and they can impact resilience of an individual. Genetic predisposition to relationship trauma. So genetics it can predispose a person to trauma in the relationship. The individual who has had a difficult childhood, who has faced a lot of adversities in his childhood, it can be, studies reveal that they have it can be related with the intimate partner violence, and these people can be more vulnerable to this relationship trauma. Then there are neurological mechanisms also which are related with the trauma. So genetic variations in neurotransmitter systems such as serotonin and dopamine, they have been found to have an impact on the trauma. So for example, serotonin transporter gene, it has been found to have high association with heightened reactivity to stress and increased risk of PTSD. So in PTSD, this gene, which is I mean, this is transferred to the other from one generation to the other, and it can also predispose a person to traumatic experiences. Third one is epigenetic modification. So epigenetic modification, there are various studies that have occurred, that have taken place in this area, which tells us about the relationship of the environment and the genetic expression through epigenetic modification. So this tells us that how early life experiences, including relational trauma, can lead to enduring changes that can impact stress reactivity and resilience. Impact of genetics on relation dynamics. So how our attachment, like it tells us that how our attachment styles are influenced by it. So genetic factors, they contribute to heritability of attachment patterns, which can um, manifest themselves in the form of relationship dissatisfaction or satisfaction and stability. Then second is interpersonal sensitivity. So genetic variation in oxytocin receptor genes, they have also been found to be linked with differences in interpersonal sensitivity and social bonding. So it tells studies by Epstein and Rodericks. It tells us how genetic factors can influence individuals' capacity for empathy, trust, and emotional attunement within the relationships. Then risk of intergenerational transmission. So there is also a risk of it, like um, genetic predispositions to relationship trauma. It might increase the risk of intergenerational transmission. It can be the genes which carry the information related with the trauma that can be transferred to the next generation, and which can impact the relationship dynamics, um, and the cycle of the trauma it can go on. Then comes spirituality and trauma relationship. So spirituality, as we know from the history, that spirituality has offered a framework for understanding our place in the universe, and it tells us about the meaning and purpose that we have in our life. So spiritual beliefs, many studies have been done in this area, and it has been indicated that spiritual beliefs helps us in understanding the adversity, and also finding it helps us in finding meaning in the experiences that an individual have during relationship trauma, and also helps us in better dealing with the um, relationship trauma, and also can lead to personal growth. Then it also provides us existential reflection. It helps us in understanding and finding answer to the questions which are related with love, trust, and the nature of human relationships. And spiritual practices such as prayer, meditation, or journaling, it can help us in gaining insight into um, ourselves, and understanding the and getting the answers to the existential to our existence, or existential questions that we have. Then it also helps us in understanding and providing coping strategies which can help us in navigating the emotional and psychological challenges that we face, that individuals face in relationship trauma. It also provides us with resilience and growth. So, studies have revealed that spirituality has been linked to post-traumatic growth, in which the individuals they gain insight into themselves, and they become more resilient, and they can transform to a better person, and they can like spirituality, it helps in this area. Then spiritual forgiveness. So forgiveness, when an individual, like in the in our religious texts and the spiritual aspect, if you see, then the forgiveness can have profound effect on healing of an individual who has faced relationship trauma. So he can overcome and release resentment, anger, and bitterness which the individual has faced in the relationship. Then it also helps us in restoration of the trust, because trust is there are trust issues, as we learned earlier, that because of the relationship failures, people often have trust issues. So spiritual practices that can help in restoring the trust of an individual. Then there are various spiritual communities where people they can attend, and when they participate in such religious activities, they find support groups there which can foster a sense of community and solidarity, which will help in alleviating isolation and loneliness in these people. Then compassionate presence. Spiritual communities offer a space for compassionate presence, and empathetic listening is there. So people find validation there, and they are accepted. And also they find people of the similar beliefs and values, which helps them in healing. Then karma and personal growth. So personal karma has been like studied in Eastern philosophies, but it is now accepted in Western psychology as well. and various studies have taken place in this area, which highlights the influence of karma on resilience and personal.
I'm sorry to disturb you in between, Dr. Anita. Participants, please, all of you, keep yourself on mute. There are one or two participants who are not on mute, and because of that, there is so much of echo and disturbance in between. So please do the needful.
Karma, the theory of karma, it helps us in understanding and uncovering the psychological mechanisms which are there, and which helps us in understanding the adversity and how to deal with it. When we are talking about relationship trauma, how can karma help us? First is interconnectedness, and various research, like there is a recent research in this area, which was done by Gupta et al., which highlights the concept of interconnectedness and the concept of karma and relationship trauma. So, when we understand that how our karmas are, how we are interrelated with the past and the present, so it helps us in understanding the dynamics of the trauma, and also helps us in understanding ourselves and the other individual, other person, from the point of karma. And second is karmic patterns. So karmic patterns, they can be the karmic patterns mean there are repeating cycles that people experience in terms of behavior and experience. So these cycles can be broken by the understanding of theory of karma. Then there are personal agencies. Personal agency in which the individual will take the responsibility of his or her actions and behaviors, and which will also help in transformation of this individual and the relationship. Then opportunities for growth. Understanding the theory of karma, it can help us in confronting the past experiences, past actions, and will provide insight, and positive changes in the behavior can occur because of understanding of karma. Then it would also help in compassionate understanding. Compassionate understanding means when an individual will be compassionate towards himself and the other person, um, the partner. So it will help in healing and reconciliation. Then is forgiveness. Forgiveness can break the karmic cycle or the karmic patterns, and it would also promote healing and resilience within the individual. Then conscious intention, when we consciously invest into something, then it can also um, lead to creating positive karmas, and will foster fulfilling and healthy relationship. Then practicing generosity and love kindness, this will also help in uh, creating positive energy and healing the relationship. If we incorporate all these things in our life, then it can help us in growing, in personal growth. And if we embrace the spiritual beliefs, it will also help us in understanding the meaning and the purpose of our life, which will guide us towards our growth, and also would heal the relationship. Then the theory of karma, it would help us in making mindful choices and sense of personal responsibility. And if we acknowledge the genetic influences, then we will become more aware of our strengths and weaknesses, which will also help us in understanding our way of dealing with things. And it would also help in understanding past traumas, if we and also would help us in seeking support and healing from them. While dealing with the trauma, I would say that multi-dimensional approach would be um, helpful, as it would encompass attachment style, spirituality, karma, and the genetics. And by integrating all these factors, people can um, be given support, and they can transform, they can become healthier, and also their relationship will be more fulfilling. I'm sorry, fulfilling. Then, so holistic approach or holistic understanding of the relationship trauma, it would help us in being more resilient, compassionate, and will help us in growing. So I would say that we should resort to a multidimensional approach. Thank you.
Thank you, ma'am, for an eye-opening presentation on the psychological dynamics of struggling couples. Thank you for
I'm
sharing
really
your
sorry.
expertise with us.
Thank you, but I'm really sorry. My throat was bad today, so
It's
that's
fine, ma'am.
It was a good presentation, Anita, and enlightening as well. And even both the speakers have shared so much of knowledge that it is probably not overwhelming. Is it overwhelming? Right? But it is the need of an hour, and being a psychologist, you should be aware of uh, what goes on in the mind when we talk about trauma, when we talk about happy relationship, and why there are certain cases who are not able to be okay even during with therapy, right? Because there are certain permanent changes that happens in the brain and we ignore the same. So what we need to do is we need to take into consideration that how much damage has been done. And being a psychologist, it is our duty. Over to you, Rita ma'am. In the meantime, Dr. Lobsang is also joining. He's trying to join. Over to you, Rita ma'am.
Just a minute. Yes, thank you so much, both the speakers, for giving amazing knowledge to our students. But if anybody have any question, can raise hand. Any student want to ask anything? Nobody has any question? Bhavya Datta. Yes, Bhavya. Uh,
Since Bhavya Dua at this side, I would like
Dua.
to ask
Yes.
if Dr. Rajkiran is still in the meeting.
Dr. Rajkiran, are you there? I don't think so, Bhavya.
No worries, ma'am. I'll connect with him on LinkedIn.
Okay,
Thank you, ma'am.
sure. Anybody else wants to ask anything to Dr. Anita?
Dr. Raj Kiran is a consultant and advisor of psychiatry in Speaking Cube itself. So, whatever query you have, you can always write to us and we can share it with sir.
Great, ma'am. Thank you so much.
And if you people have any query, any doubt, you can ask even after the session. Do not wait for the expert to leave and then ask, okay?
You can write in the comment box.
You can always write in the comment box
Yes,
and
ma'am.
we can take up the questions and queries.
Anybody else have any question? I think with both the cases, both the speakers, you have learned so many things. And why this voice is echoing? Just a minute.
And Dr. Lobsang is trying to join. He was in the call, but then he got logged out. He's trying to join.
Okay. I think students, many of you would have done research on adverse childhood experiences also. And many of you would have studied about them. And very rightly, both speakers have informed us about researches and their practical experiences, as Dr. Dontu has shared with us, that many of the mental health issues are rooted into childhood trauma. So that is why it is important to understand with for ourselves also and for our clients also. If any of the issue is there, which maybe we are not able to handle, it is important to go to the experts and get the issue resolved so that we can move in a very healthy life, personal and professional as well. So that is why it is important for psychologists also to understand that this kind of counseling is required to everyone. As yesterday I was talking about addiction and trauma, then this is also an important aspect, that there are two things whenever a trauma occurs within us in our life. And number one thing, everyone has to remember that there is no exception on this earth, the person who has not faced any trauma or who will have not to face any trauma. God forbid me, but yes, I have seen with my students, many of them, when they lose their grandparents, even they go into such a deep trauma that many times they find it difficult to cope up with their regular college and their studies as well. So, means we can say that there is no one who has not faced any trauma in the life. And that is why, whenever the trauma occurs, we have two paths. We have two paths in front of us, either to sink into the trauma and to be overwhelmed as much as that never be able to come out of it, or we lose so much time and energy in coming out of this trauma. But another way is to use the trauma as a springboard of your growth, because trauma is that experience which gives us that understanding also, that yes, we can come out of it, as we have to pass exam to be upgraded into the qualifications, education. Somebody wants to become IS officer, toughest exam that person has to give. So that is why we all have to give this examination in the life. And for that, if we want to qualify to the higher levels in the life, obviously exam will be there. So that is why it is important to understand that we need to prepare for this exam on the daily basis. We cannot wait when the date will be declared, we will start working on it. Uh, Trauma does not give. So that is why trauma is like that, that it comes as a surprise in our life. We cannot think that it will tell us before coming. So that is why we need to keep on working on ourselves on the daily basis and be prepared. With this preparedness, if we are ready for it, then we will go on the another path, that is post traumatic growth. And as the researchers have been shared yesterday and today as well, the researchers have said that the people who were following one or the other spiritual practice, or they were spiritual, they have got post traumatic growth instead of PTSD. So there are two things, post traumatic growth or PTSD. Now we all have to look forward for the post traumatic growth. Whenever the challenges come in our life, whenever the difficult time comes in our life in any way, we can work on us and grow to evolve as a better person than before. It means we are working on us instead of trying to work on other people. It's better to work on the self. I have learned this in my life. Better to work on the self. Yes, we are working on the client, that is our profession. That is our profession, that we are working on the clients. But in our personal life, in daily lives, we need to work on ourselves. And when we are working on ourselves, then we will be able to evolve better, to grow better, and always emerge as a strong person. If you are strong, you will pull out others from that pit of the trauma. If you are not strong enough, then bringing out other people from the trauma will be difficult task for us. So that is why self resilience is very important. If we are empowered, we will be able to empower others. If we are weak, already we are weak, we can't empower others. We cannot pull out others from that difficult periods of the life. That is why it is important for us to work on the self resilience, emerge as a very resilient person, so that you can be able to pull out others. And I feel it is very important for psychologists to be resilient, work on self resilience, so that we can make others also to be resilient. Because obviously, we will be meeting the clients, we will be meeting the people who are facing so many challenges in their life. Yes, Dr. Deepika, has Sir joined? You are in the mute.
Dr. Lobsang is trying to join. He was in the meeting, but then somehow he got logged out. So that is it. So no worries, he is trying, but in the meantime, it can be an interactive session for 10 to 15 minutes. And
Yes.
students and professionals, we have students and professionals from psychology, that too from different time zones. I have a question, right? Either you can unmute and say, or you can just write down in the chat box. Are you satisfied with your life? And we are going to connect the questions at the end. Are you satisfied with your life? Quickly, quickly. Write down in the chat box or unmute. 50%. Oh, okay. Yes. Somebody says, yes, I'm satisfied with my life. Okay, good. Yes. Okay, there'll be a kind of mix responses. This is what I'm expecting. Not completely, yes, 50%, completely satisfied. But at the end of the day, we human beings are made in such a way that we cannot be satisfied, right? Underline. We cannot be satisfied, but we can always try hard to go close to perfection. And that is what realization is, right? When you say 100% satisfied, it means that you are completely realized and you are completely actualized. And it is a process. It takes time. And this is the reason that you might have seen a lot of elderly people who are not satisfied with their life. Because we are trying hard, but somewhere down the line, we are not able to accept ourselves. So the underlying thing is, the thing that needs to be noted is, you need to accept yourself. You need to accept who you are. And this is the crux of trauma management. You have, by now, you have heard a lot of people from different background, be it politics, be it biochemistry, be it microbiology, be it psychology, be it psychiatry. Today, we'll be having a biochemistry session also. And ma'am will be talking about how mind is connected with the gut, right? So the way you look, the way you think, and the kind of personality you have developed, it or it's or everything is dependent on your consciousness. Everything is dependent on how your mental patterns are developed. So when it comes to satisfaction, look into yourself. Am I satisfied? Oh, I'm not satisfied. If you ask me, no, I'm not satisfied, but I'm on a journey towards satisfaction. I'm on a journey towards the realization. Every day I look into my actions, every moment I look into my actions, and try to find out, okay, this is what I have committed a mistake here. I accept it, but I'll not repeat it. This is what realization is, right? Realization is not something getting enlightened. The meaning of enlightenment is to know yourself. So the simple thing that you have to do is, one technique that you can do every day is go close to yourself. Every day a step towards your own self. But what are we doing? We are dressing up for somebody else, right? We are looking a certain way for somebody else. We are thinking in a certain way for somebody else, right? And that somebody else is nothing but society. Is it? Yes or no? So the day you will start thinking about yourself actually in reality, it is going to be the journey, a marvelous journey towards your own self. And at the end, who's going to be with you? Your parents? No. Your friends? No. Your partner? No. Your kids? No. Who's going to be with you at the end of the day? It's you. It's you, your satisfaction, your love towards yourself, your respect towards yourself, and your guilt toward yourself. So people who face a lot of trauma in life, if you ask me, have you faced trauma in your life, ma'am? I will say, okay, if somebody else will see my life, it is going to be full of trauma, right? But at the end of the day, I chose the pathway of hope and resilience, right? Whenever you face any kind of trauma in life, there are only two pathways. One is the pathway of hope and resilience, which is difficult. The pathway of hope and resilience is difficult because every moment you have to accept your flaws. Every moment you have to transform your flaws, right? And you don't say, मैं तो ऐसा ही हूँ. I am like this. I do not want to change. But the change is the innate nature of the human being. Remember that. It's the innate nature of human being because we are impermanent. What I was yesterday, what I was a minute ago, my body and my mind is not that now because I have aged in 24 hours. Even I have added some information a minute ago with these two lectures. So I'm a changed person. Likewise, we are. What Bhavya was yesterday, he is not now. Right? And this is the motto of this particular conference. To make you people realize not to publish your paper, not to present your paper, that is a secondary thing. But to make you people realize that you people are really, really important. You people are really, really important because you are the future of the world. I've already lived half of my life, right? Likewise, Rita also has lived more than half of the life, right? But you people have more than half of your life ahead. Live gracefully, live bravely, live peacefully. And this can only be achieved with only one thing. And what's that? Love yourself. Go close to yourself every moment. Bhavya, please go ahead.
Yes, ma'am. If I may add, my voice is.
Yes, please go ahead.
Yes, do you have a second device? Something वो आवाज echo हो रही है.
Hmm.
Ma'am, please
No.
unmute it.
It's
Mute us.
I'm on mute. I'm on mute.
Um,
Is it somebody else? Is it somebody else?
I guess इस वाले से भी अभी के लिए नहीं निकलेगी तो शायद.
Okay. But yes, have you people heard me? So
Yes,
the
ma'am.
only thing that you have to take away is
To love ourselves.
start accepting the way you are.
Yes.
But remember that you are a changed person every moment.
Yes, ma'am.
Accept that as well. And I think Dr. Lubsang has joined. Dr. Lubsang, are you there? Yes. Dr. Lubsang has joined. Ma'am, can you see Dr. Lubsang? Yes.
Yes, ma'am.
Sir,
Yes,
can
ma'am.
you please unmute yourself? Okay, Sneha, please introduce and then sir will start.
Yes, ma'am.
Yes, ma'am.
And please mute yourself, or if anyone is on mute. My voice is echoing, right? Guys, please.
Lubsang, sir, please mute yourself.
Hello. Hello. Am I audible or not?
Yes, sir, you
Sir,
are.
you are
Yes, sir,
audible.
you are audible.
Okay, thank you.
Sneha, please go ahead.
Okay, ma'am. Okay, so now I will invite our third guest speaker, Dr. Professor Lobsang Bhutia. He's the head of the department, Tibetan Buddhism, Central Institute of Buddhist Studies, Ladakh. So, sir will share his wisdom on the topic self-love through meditation. Over to you, sir.
Thank you. Thank you, Sneha. Uh, First of all, I would like to uh, offer my thankfulness to Dr. Uh, Professor Madam uh, Rita ji and Dr. Deepika ji for inviting me to this international conference. And at the same time, I also welcome to all the others participant to this session. Today, I have been asked to share something about self-love to meditation. What I think about this topic, uh, as you know that we all human being, especially we all human being, including all sentient beings, they all, uh, love themselves. For example, like, from morning to evening, the moment we wake up and the moment we, go to sleep, in between the whole day, whatever we do, directly or indirectly, these are all the, activity that we are trying to feed ourselves as a sign of self-love. For example, the moment we wake up and then we go to the kitchen. After that, we have a tea, and then after having a tea, we usually have a breakfast. And this all activity, if we if we try to experiment in our life, that this all activity is somehow the sign of we are loving. It is a self-love activity of self-love. But the problem is that the activity that we are doing throughout our whole day. That activity as a sign of self-love. Uh, it will, yeah, for sure, it will definitely give you some sort of satisfaction. But that satisfaction, that sort of, satisfaction never lasts forever. When the new condition occurs, their satisfaction, naturally fade away. So again, we feel very much, sort of, insufficiency. We feel very much sort of, something's lacking in our mind. But again, we are doing, some sort of activity in order to, satisfy ourselves. But something is lacking there. Every time or every way, uh, what we are doing. Well, why it is happening? Because, first we need to understand what actually the self is. Because the moment we do not understand the what actually the self is, then the mechanism as a love that we are doing through, through different modes of activity as a sign of love to ourselves, that will not definitely, worked properly. The self, according to, according to me, the self doesn't mean that, uh, the physical appearance that we are, the physical appearance, some sort of, physical, some sort of, artificial appearance, that we have from morning to, evening. We are trying to, satisfy this kind of, very, gross level of, in appearance, gross level of self-made appearance. But that is not, actually the, the real meaning of self. When we are talking about the self, first of all, we need to know that what actually the self is. Self is the nature of the mind. It is a natural property of mind. It is not just in the, outer reflection. It is not just a, physical appearance. It is not the grossly, level of personality. The self is the, natural property of mind. So without understanding this, you know, uh, natural property of, mind, one cannot, love, uh, one is not able to love how to feed that self. So in all, because, I've been asked to say something about the meditation, because meditation is the mechanism, is the way, it's a natural process. It is not an external process. It is a natural process, natural process, process of, digging out that self nature, which is, inherently existent within. So when we do the meditation, meditation is a process. At the same time, it is the process of loving oneself. Because when we do the meditation, we are trying to dig out that, natural self. We are not trying to, trying to identify the artificial self. We are trying to digging out that natural self. And when we are able to dig out that natural self through the, practice of meditation, then definitely, we will, yeah, we will able to, you know, will able to succeed in, loving oneself. Otherwise, other mechanism, whatever it is, that will just satisfy for temporarily, because it is totally attached with the outer appearing appearance self, outer uh, appearing physical appearance that is motivated with the self. That's the reason. So meditation is very important, necessary, significance in our life, because we all, undoubtedly, we all love ourselves, love oneself. There's no doubt. But loving oneself, how to love? So there's only one mechanism, that is called as meditation. So again, what actually the meditation is, it's very simple. It's very simple in the sense that meditation, the word meditation has a connotation of uh, getting, familiarized with oneself. This is the, literally meaning of meditation. Meditation doesn't mean that, there's a different type of meditation, but meditation, most of the people, they take meditation as a, very much religious activity. It's not that. Meditation is very much secular. It is a very much, it is what we call a natural, uh, process to know oneself. To know oneself means our own national property of mind. Without adopting the process of meditation, one cannot understand what actually the self is. There's no way. So that's the reason. If you love oneself, so we have to do the meditation. By doing meditation, one can understand. By doing the meditation, one can understand what actually the one is in reality. Otherwise, we are always chasing, this elusive appearance in order to satisfy this elusive appearance. So that's the reason meditation is very important in our life. It's very significant. Is it necessary? I'm using the word necessary because meditation only has a capacity to dig out itself and offer to that self. Then what is the meditation? I have just now mentioned that meditation is a process of, it is a process of getting familiarized with that you know national property of mind, what we call a self. So 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 meditation is for that. That is when we understand that self nature existed inherently in the mind, which is the property of mind, then we'll understand what actually our identity is. So that's it. Is the meditation is very important. In other words, I can say the meditation is the process of internalization, not an externalization. Most of our mundane activity, it is a process of externalization. So meditation is not for that. Meditation is, process of internalizing. Internalizing means it is a process of, looking inside. It is a process of looking inside. When we are able to, look inside properly, then moment we understand what actually the self is, that moment, a deep kind of satisfaction naturally arise in our mind. Then the genuine kind of happiness definitely, sprouted, out in our mind, from our mind. It's no doubt. That's the reason meditation is very important for self-loving. Because we all, we all sentient beings. Not only I'm talking about the human beings, for sure, human beings, for sure. All sentient beings love themselves. like a dog, cat, every animal, if you just hit them, then they will react. When they will react, it is a sign that you are hurting them because they, they love themselves. So so that's the reason what I'm saying. The meditation is the only mechanism, only way, only path, only approaches to understand the self. And the moment we understand the self, that is the pure love for oneself. It's very simple. It's very simple. Meditation, meditation doesn't mean the it's sort of in the religious sort of activity. It is a national activity. In Indian tradition, a word meditation has the equivalency, equivalent word as a bhavana. And in Tibetan, words, it is in Tibetan. There's a word like gum. It is directly translated from the word like bhavana. What is a bhav? Bhav is essence. What is the essence? Essence of the mind. That is the self. The right now our appearance, our physical appearance, is a reflection of the self. It is not real self. It is the artificial self. It is the representation of the self. So self-loving means that you are loving to your own genuine sort of identity. That is a self. There is a power. There is a consciousness. So in order to understand that conditioned nature of our mind, our identity, our real identity, there's only way. Meditation is the only way. There's no way. Only way is meditation. That's the reason bhavana. Bhavana is the process of experiencing that bhav. It's a bhavana. So that's the reason in Indian tradition, meditation is meant for that. Meditation is not for just just to just to attend relaxation. Yes, when we do the meditation, yes, for sure, you will feel relaxation. But the relaxation is the benefit that we get on the way while we do the meditation. It's not an ultimate destination of meditation. For when we do the meditation is meant for that, destination, that is to experience that bhav, that self. So on the other way, I can say the self-love, how to love oneself. So only the meditation can be the mechanism for self-loving. That's the reason in Indian Indian tradition, meditation is a part of life. Without meditation, without meditation, without adopting meditation technique as a part of life, one cannot be happy in our life for sure. Because the external material and external mechanism cannot satisfy us for sure. Because because their vastu and vyavastha cannot satisfy oneself. These are the small part of mechanism, but the real part of mechanism is for self-loving. Is to understand, is to adopt the technical meditation in our life. By adopting the technical meditation in our life, then one will understand what actually the our real identity, that is the self power. We can touch that level of power. The moment we touch the level of power, experience the power and self, then the genuine kind of happiness will start arising within. So meditation is meant for, meditation is meant for that purpose. So that's the reason meditation is for that. Meditation is for that. And for doing meditation, So how to do the meditation? This is just a general figure of meditation. Why we do the meditation? So for doing meditation, there are there are broadly two type of meditation. This all in a technique that meditation techniques comes from the Indian tradition. In the Western, we do not have this kind of tradition, for sure. So for doing meditation, there are two broadly classification. One is the Shamartha meditation, and one is the Vipassana meditation. Shamartha meditation means that calm, abiding meditation, because normally our mind is very much distracted here and there, here and there, because because normally our mind is very distracted, because we use our energy here and there. We are not controlling our energy. We are using energy towards useless stuff. So that's the reason shamartha meditation is for collecting that energy into one place, on one place. So when our energy become total assemble towards one place, then will naturally become very calm. So that's called calm abiding meditation. Sham means calm. Sham. Stha means abiding. Shamartha. So then after that, when we are able to do that shamatha meditation, calm abiding meditation, by following the technique of calm abiding meditation, for sure, our mind become very calm, composed, and full of energy. When the mind become calm, composed, and full of energy, then that energized mind can only see that truth, can only understand that bhava, can only understand that self. So that's the reason. The next type with vipassana. Vipassana means insightful meditation. Vipassana means seeing something special. What is that? When we touch, the that self, nature of mind, which is right now remain in our remain within our mind in a very subtle level, then we understand what actually the life is. We understand what actually our reality is. This is what meditation is meant for. So there's an everywhere. If you go everywhere, they will teach you the calm abiding meditation, shamartha meditation. So shamartha meditation is meant for that purpose, only for calming a mind, only for collecting the scattered energy of your mind and put your energy into one place, and then after that, when your mind is full of energy, use that mind into mind for looking the truth inside, internalize that mind, use that mind for the process of internalizing yourself. And then moment that when we use that in the mind, we'll understand what actually our pure identity, our pure power is. The moment we understand that moment, what we call a vipassana. When we attend the vipassana, I think the moment we understand moment we touch to that level of to that truth of ourselves, then the love, the happiness, the satisfaction, which is a genuine, which is never fading, will happen for sure. So that's the reason self-love to meditation. So self-love So, so self-love, when we say the self-love, meditation itself is a process of loving to oneself. So that's the reason meditation is very important. With this small note, I think, I will, I think, I will stop my, uh, presentation here. So if you have any doubt regarding this, then you are most welcome to ask me anything. Thank you. Thank you so much.
Thank you, sir. Thank you for your enlightening talk on self love through meditation. Your insights have inspired us to prioritize our own well being and cultivate a deeper sense of self compassion. So, for the viewers, let's remember to nurture ourselves with kindness and mindfulness as we continue on journey of self discovery and growth. So, with that, we have our next guest speaker, Professor Dr. Devendra Singh Rana. He's an associate professor clinical psychology, PGI Chandigarh. Sir will enlighten us on the topic impact of alcohol dependence on happy relationship.
Professor Devendra is here.
Just a minute. Yes, I'm here.
Yes.
Right click on small search filters, left side. Just a minute, ma'am. Are you able to see my slides?
No, sir.
Not yet.
Just a minute.
Yes, now. Now we are able to see.
Now you are able to see.
Again, it went off.
Now you able to see, ma'am?
Yes, yes.
Okay, right. So, good morning, one and all. I'm getting my voice. Has it go? Hello. Yes. So today my topic of presentation is impact of alcohol on happy relationships. Before going to my presentation, I would like to know whether you are comfortable in bilingual, English and Hindi both, or should I speak in English itself?
There are few participants from South Africa and US
Right,
as
right.
well.
Okay.
So I think English will be fine.
So first of all, I will tell you about some statistics about substance abuse. Grossly harmful use of alcohol is contributed towards 200 disease and injury conditions. And across world, there are 3 million deaths every year which result from harmful use of alcohol, and which represents 5.3% of all deaths. Overall, 5.1% of global burden of disease and injury attributable to alcohol. And beyond health consequences, the harmful use of alcohol brings significant social and economical losses to individual and society at large. This alcohol consumption caused death and disability relatively early in life and in people aged 20 to 39 years. And there is etiological relationship between harmful use of alcohol and a range of mental and behavioral disorders and certain non-communication communicable condition and injuries. So before going to my real presentation, I would like to introduce you certain terms which are related to the drugs. First is acute intoxication. This is temporary and transient conditions following intake of alcohol. And after taking alcohol, there is disturbance of consciousness, cognition in terms of intelligence and memory, perception in terms of delusion, hallucinations, affect and behavior in terms of your behavior, elation, exultation, depression, crying, laughing. Then psychophysiological functions and responses in terms of elevated BP, elevated no, heart rate, tachycardia. So there are certain symptoms which are happening during acute intoxication. Means a person has actively taken the substance now. Then harmful use. Basically, this harm is occurring to two health point. One is health and second is mental health. Like if somebody is taking drugs via injectable, then he may get hepatitis. And if somebody is taking alcohol or cannabis, he may get depression or he may get schizophrenia, which is secondary to cannabis. So this is harmful use. Using the substance, then getting health and mental health conditions, disorders. Then how we can say that somebody is dependent on drugs, somebody is alcoholic. So there is certain criteria based on which we can say that this person is totally dependent on alcohol. Simply taking alcohol once or twice in a month or once in a week won't make one dependent. Rather, to make him dependent or alcohol dependence syndrome, we need to have these 6 criteria. So first of all, he will have strong desire to take the substance, and this desire is irresistible. He can't control this desire, it may occur at any time. Secondly, he has difficulties in controlling substance taking behavior in terms of onset, termination, and level of use. He doesn't know when to start, will start 7 a.m. in the morning. He doesn't know what is the level of alcohol he should take, maybe one bottle, half bottle, and he doesn't know when to stop. Third is physiological withdrawal state. This is the state which is substance specific. Suppose somebody is taking alcohol, and after taking alcohol, if he gives up for about 2 to 3 days, then he will develop certain symptoms like memory disturbances, tremor of hand, shaking body. Then, you know, these withdrawal symptoms are specific to substance. There are different withdrawal symptoms for alcohol, different withdrawal symptom for cannabis, different withdrawal symptom for opiates. Then there is evidence of tolerance. Suppose somebody starts taking alcohol. Initially, he takes 60 ml of alcohol. Then, to get the similar effect which he used to get earlier in 60 ml, he needs to take 300 ml. In 300 ml, he is getting same effect which he used to get in 60 ml. So this is called evidence of tolerance. Then there is progressive neglect of alternative pleasure or activities. Then persisting with substance use despite clear evidence of overtly harmful consequences. So out of these 6 criteria, if somebody is meeting 3 criteria within past few months, then we will say that he is totally dependent on drugs or dependent on alcohol. Then what are the common effect of alcohol? In low doses, mild doses, maybe up to 100 ml, it has a relaxing effect. It reduced tension, lowers down inhibition, and there is impairment of concentrations, and reflexes are usually slows down. Reaction time is totally impaired, and coordination is totally reduced and impaired. And in medium doses, there is slurred speech, drowsiness, altered emotions, and in high doses, there may be feeling of vomiting or actual vomiting. There may be breathing difficulties, unconsciousness, coma, and death. Usually in 400 mg per 100 ml, there may be unconsciousness, coma, and death. So higher the quantity of alcohol may lead to ultimate death. So effect of chronic use of alcohol, there may be damage to the frontal lobe, that is dorsolateral prefrontal cortex, executive function, planning, spatial memory, working memory, short-term memory. Then overall, there is reduction in brain size in terms of neurons and dendrites. Then it may lead to alcoholism, that I told you what is alcohol dependence syndrome. So may met criteria of ADS. Then may cause vitamin deficiency that will ultimately result into wernic encephalopathy. So effect of chronic use of alcohol, like there may be liver cirrhosis. The picture on the top is healthy liver and picture at the lower end is liver cirrhosis. This is kind of conditions where liver transplant is the only option, otherwise death is imminent. Then we have fetal alcohol syndrome. This is basically condition acquired by an unborn fetus and caused by mother drinking alcohol during pregnancy. If somebody is pregnant and is taking alcohol, even one episode of alcohol can lead to fetal alcohol syndrome, because this alcohol passed through the placenta and goes to the brain of the unborn child. That is the biggest cause of mental retardation in current scenario. Then there are certain factors which are responsible for alcoholism, that include ineffective parental family management techniques. There may be complete lack of discipline, or there may be inconsistent discipline. Suppose father is not coming to home, he will come in once in a month and he will slap children, he will beat children. There is negative communication, there is no praise for the child, there is total blaming and criticism in the family. Then poor family relationships, like there is low bonding within the family, there is lack of affection, poor communication with the child, and sometimes there may be child abuse within the family in terms of physical or sexual abuse. Then single parent childhood, either mother is not there or father is not there. Then parental role modeling. Suppose somebody parents are drinking, then definitely there are chances that their offspring will also drink. If parents are criminal or antisocial, if parent use drugs, so in such conditions, it is likely that their offspring or children will also get into this kind of alcohol use. If parents or the society has a positive attitude toward drugs, so all these factors will contribute to alcohol use in later life. Then what is the statistics about alcohol? Complete research shows that this alcohol use can have negative effect on personal and professional relationships. The approximately 1 in 10 children in US, just I'm sorry. So approximately 1 in 10 children in US live with a parent who has an alcohol use disorder, and a consumption increase of 1 liter of alcohol per capita resulted in 20% increase in divorce rate. So there are direct relationship of alcohol use with increase in divorce rate and interpersonal difficulties. Then spouse of people who misuse alcohol report increased rate of anxiety and depression and decreased level of marital satisfaction. Then spouses of people who do not misuse alcohol. Then also heavy drinking was associated with the higher absenteeism at work in the following year. So these statistics are clearly showing that there is problem with alcohol pertaining to interpersonal relationships. And first of all, what are the signs that alcohol is causing issues in your relationship? When a person feels that alcohol becomes more important than your relationship, if a person forget about important dates, he cancel out different plans, he hang out with his friend drinking or taking substance. So this is the early sign. Second, you become a different person when you drink. Like you become withdrawn, you become aggressive, you become impulsive, you might act inappropriately in public and appears irritable due to alcohol withdrawal. So withdrawal, substance withdrawal, alcohol withdrawal will definitely change you. That will make you irritable. That will make you withdrawn. That will make you painful, and you will show those symptoms to your spouse, to your family. And sometimes you are dishonest about your drinking, because honesty is the main base pillar of strong relationships. And you keep your drinking secret, and you keep your drinking hidden from your spouse. That is the biggest reason. Then fourth, you have replaced certain activities with drinking. Suppose you used to go to movies, you used to enjoy with your family, you used to go to exercise, you used to go gym. So those activities are replaced totally by alcohol. The next is sex drive has changed drastically. Usually due to excessive alcohol use, there is decrease in sexual drive, and that may result into erectile dysfunction and premature ejaculation. And this may lead to further deterioration of interpersonal relationship or intimate relationships. So first and foremost effect comes on intimate relationships. This effect of alcohol on relationship and intimacy is definitely widespread. Drinking can definitely impact intimate relations and affections. So there are certain areas which are most affected due to alcohol. That is trust, stability, affection, expectations, commitment, shared values, and respect. So major chunk of disturbances are coming with regard to trust, stability, and these particular areas. So what about mistrust? They may lie to their partner or family about where they are, with whom they are spending their time, and what they were doing during the day. So where they were, with whom they were, and what they were doing during the day. This is the major mistrust. And as the addiction progresses, they may devise more elaborate excuses to hide their drinking problem. And a friend or partner may constantly hear reasons for being late, disappearing, or mood swings. So there is no trust between the relations between husband and wife, and there is bundle of lies, bundle of hidden information, which is coming to the relationship, which is spoiling intimacy. Then alcohol alters one's personality. Person become irritable, becomes impulsive, becomes aggressive, becomes liar, more secretive, and hide information from the partner. So all these contributes to the deterioration in intimate relations. Then stability is next factor. So people with addiction may opt to drink and go to bars rather than be with loved ones. This causes a lack of relationship stability, and without consistent and solid foundation, relationships can become strained. So to make a relationship more stable, we need to have trust, and we need to have proper timings which is spent with the family. Then affection. People affected by alcoholism may feel more irritable and angry while intoxicated or going through withdrawal state. So again, if somebody has taken the substance, is off substance for 2 to 3 days, then there may be withdrawal symptoms, which I told you earlier. So in withdrawal symptoms, this affection is taken over by irritability, anger, aggression, impulsivity, fighting behavior. They may neglect their relationships and show less affection and care for those they love. So in this way, alcoholism is affecting intimate relations. Then commitment. Commitment is must for a healthy relationship. People who take alcohol may make false promise to change their drinking habits, or they forget to attend important events such as anniversary or birthdays, and this can result in broken relationships, or this can further harm or intimate relationships. And then there are certain other factors which are responsible for deterioration in relationships, like codependency and abuse, financial troubles, alcohol and children, alcohol and friends and family, alcohol and professional relationships, alcohol and personality, alcohol and psychiatric illness. So codependency means if somebody is dependent on somebody. So one of the many complex aspects of alcohol use disorder is when codependency and alcohol misuse intersect. Alcohol codependency occurs when a person becomes reliant on someone and their alcohol misuse hinges on their partner's behavior. A partner of someone addicted to alcohol may believe they have helping the other person by enabling the addiction to continue. So in some way, that codependency on other person, the other person is helping or is working as a enabler to further enhance substance taking behavior or alcoholism. And in reality, they are doing it for themselves while encouraging an unhealthy dynamics. Then financial troubles are, well known. There may be unwise spending while under the influence of liquor. They may take, high price liquor. They may spend on friends. They may spend extra on food and snacks. And those who drink at home might make online purchases they may not have otherwise considered when sober. So there is extra spending. Then there are chances of job loss. Somebody is taking alcohol in the evening, then going to workplace with the hangover, will take leave, will spoil their relationship with their colleagues. So ultimately, there will be lack of continuity in job and lack of poor performance on the part of the candidate or part of the drinker. Then increased medical expenses because alcohol is related with many psychiatric and other disorders. And if one medical or psychiatric disorder comes, that will put extra financial burden on the person, and that will definitely spoil healthy relationship, happy relationships. Then alcoholism and children. So drinking can affect a personal relationship with their children and can hurt a child's emotional well-being. Children of people who misuse alcohol can have an elevated risk for behavioral and emotional problems and can experience increased feeling of anxiety, confusion, depression, embarrassment, and guilt. They can also have an increased risk of experiencing alcohol problems later in life. So here research shows that around 1 in 4 children are exposed to alcohol misuse or alcohol dependence in the family. And children of people who misuse alcohol often live in a chaotic and unstable home environment and are often subjected to abusive and negligent parenting, economic hardship, and social isolation. So alcoholism and friend and family. Thus, drinking can negatively affect a person's relationship with their friends and family. And both spouses and children of people who misuse alcohol can experience increased emotional and physical problems, including economical issues and social isolation. Friendship can also suffer. People who misuse alcohol often experience increased conflict with others or isolate themselves from important people in their lives. Then alcoholism and professional relationships. Relationships at work, including those with client, co-worker and managers can become strained due to alcohol use. Then alcohol misuse can also lead to an increase in absences, unemployment, difficulty finding an employment and financial troubles. So definitely professional life is affected by alcoholism or alcohol use. Then alcohol and personality. This any personality characteristics they work as predisposing, redirecting, and maintaining factor in substance abuse. So suppose if somebody is having impulsivity, anxiety, and depression, he is more likely to take alcohol So if somebody is taking alcohol, he is more likely to become anxious, depressive, and impulsive. So they are contributing to each other. There are certain personality characteristics like anxiety, depression, impulsivity, sensation seekers, and arousal. These are the personality factors which contributes to alcohol intake or alcoholism. And there are certain personality disorders like if somebody is paranoid personality disorder, schizotypal, histrionic, is antisocial, is borderline, and passive aggressive, these people are more likely to involve in alcoholism or alcohol dependence. So these personality types or attributes traits are changed by substance alcohol itself. And if somebody is becoming impulsive, aggressive, is highly aroused, is paranoid, is uncontrollable, then definitely this is going to spoil intimate relationship, personal relationship, and happy relationships. Then alcoholism and psychiatric illness, like after taking alcohol for long, there are chances that certain illnesses will develop. And first and foremost is Korsakoff psychosis or Wernicke encephalopathy. In this, we have certain characteristics which are related, which are associated with like schizophrenia-like symptoms, memory confusion, memory disturbances, hallucinations. Then we have second delirium tremens, usually a confused state which is almost similar to Alzheimer's disease, but it goes whenever there is rectification, modification in drinking patterns. Then alcoholic seizures. This is part of alcohol withdrawal syndrome. Suppose somebody is not taking alcohol for 2 3 days after serious drinking, heavy drinking, then definitely there are chances that he may get alcoholic seizures. That is typical of tonic-clonic seizures, and this seizure may need further treatment for 3 years. Then liver cirrhosis. Liver cirrhosis is condition where only liver replacement is the treatment, and death is almost sure certain. Then we have esophageal cancer, that is cancer of starting from this esophagus to stomach. So these psychiatric and medical conditions are bringing extreme burden on the person in terms of mental and physical health, in terms of financial health, and which will definitely spoil interpersonal relationship, healthy relationship due to excessive alcohol abuse. Then research evidence. I have cited 2 3 4 articles about real studies which will prove my points which I presented, like Journal of Applied Social Psychology 2013. So they studied almost 302 undergraduates. So they found that students in committed relationship drank less than those who were not committed. So commitment in a relationship is must. If somebody is committed, there are chances that they won't drink in future. The positive correlation between drinking and sexual contact was significant only for those who were not in a committed relationship. So if somebody is taking drink then getting involved in sexual relationship, this is usually in non-committed relationship. In committed relationship, they are usually healthy and they won't involve themselves in such kind of risky conditions during active intoxicated state. Then in second study, this is Journal of Collective Study. No. What they found that alcohol use was negatively correlated with relationship satisfaction. So more the satisfaction, less the drinking behavior. More the drinking behavior, less the relationship satisfaction. Then hazardous drinking, that is drinking that in a condition when you know that you will commit some mistake. So hazardous drinking with high relationship satisfaction indicate more readiness to change alcohol use than hazardous drinking with low relationship satisfaction. So this is contrary inverse relations between the two. People who has high relationship satisfaction won't do hazardous drinking. People who do hazard drinking won't be able to find adequate relationship satisfaction. So alcohol problems were not related to readiness to change relationship issues. And these findings indicate that highly satisfied dating relationship during calls may positively influence readiness to change heavy drinking. So satisfaction is one of the important aspect where that will help in reduction of alcohol consumption in future days. Then in other studies, this is about coping. This study was conducted on 50 wives of alcoholics to study their coping strategies. So what was the commonest coping behavior? That was discord, avoidance of husband, being assertive by the wife, and taking special action in terms of anything. Then second coping mechanisms were sexual withdrawal, no sexual contact between the husband and wife. There is fearful withdrawal from the husband, and ultimately there is marital breakdown. And third level, this study gave some insight into the coping used by. We can say that if there is alcoholism in the family, then ladies, wives, they will be using discord avoidance, sexual withdrawal, fearful withdrawal, and marital breakdown as a coping defense, which is very likely to occur in such relationships. Then this is about interpersonal violence against wives. This study was conducted in our department at PGI. They have taken 267 wives. The prevalence rate for interpersonal violence was 55% for the whole sample. So out of 100, 55% wives noted interpersonal violence against them sometimes in their lives. So out of that, 63.19% for alcohol dependence and 42.33% for opiate dependence. Also, husbands who were higher in age were more abusive, who were lower in education were more abusive, who were unemployed were more abusive, and who were from lower socio-economic status were more abusive. Also, husbands who were from nuclear family were more involved in interpersonal violence. So we can conclude that present research confirms that interpersonal violence against wives is highly prevalent among substance dependent men, more with alcohol dependence as compared to opiate dependence. So there is clear evidence that this alcoholism will spoil interpersonal relationship, intimate relationship, happy relationships. So I will conclude my presentation with following remarks. This alcoholism has disturbing impact on happy relationships. Major impact is on female partner. Coping mechanisms used by female spouse are discord, sexual withdrawal, avoidance, isolation, divorce, marital breakdown. Then interpersonal violence against wife is common in Indian sample. Alcohol use was negatively correlated with relationship satisfaction, and happy relations work as protective factor against alcoholism. So this was my presentation. Now my presentation is open for questions, clarification, discussions, comments. Thank you.
Thank you so
Thank
much,
you so
sir.
much.
Thank you for discussing about alcohol dependency and its impact on relationships. So now I would like to invite our fifth guest speaker, Professor Dr. Samru Chetri. He's a senior director and mentor, Yogananda School of Spirituality and Happiness, Shulini University, Solon. Sir will enlighten us on the topic of role of mindfulness for happy and peaceful relationships. Sir, over to you,
Thank
sir.
you. Thank you so much. Is my voice coming out to you?
Yes, sir.
Great. Let me share my slides.
Dr. Devendra, please unshare your screen. Thank you so much.
Is my screen visible? Hello?
Yes, sir. It
Yes,
is.
sir. It is visible, sir.
Okay, great. Um, so may I request all of you out there um, to kindly close your eyes, sit comfortably, put your right hand on your chest where your heart is, your left hand on your navel, and close your eyes and take a deep breath from your nose in. Feel your chest expand, your heartbeats, feel the heartbeats, feel the stomach rise, and you breathe out slowly from your mouth. Feel the easing of your heart, your stomach, falling off the stomach, and your reduction of your chest. And breathe in and breathe out. Let's do it for 6 times, measured 6 times. 3, 2, 1, go. Take a deep breath in. Feel the expansion of the chest, rise of the stomach. Slowly breathe out. Feel the fall of your stomach and reduction of your chest. Again, let's take a deep breath in. One more time. Let's just flow with the breath in and out and feel the movement of our body. One more time. Again. One more time. One last time. Deep breath in. Flow with the breath in. Feel the breath. Slowly breathe out. Thank you so much for your attention. I'm sorry you might hear some big loud music behind. If that happens, I'm sorry because there is fest going on here for the last 4 days. Today is the last day. So I'll begin my talk. It's more to do with the role of mindfulness in the relationship. How can mindfulness bring happier relationship in family and otherwise? So, first to understand what is mindfulness. Of course, we know mindfulness is to be present here and now, we say. Definitely, we are always present here and now, but it's about connection of our mind with ourself. What we think, what we act, what we do, if our awareness is connected with every activity of our thoughts and deeds, then we are in the journey of mindfulness. So, in that journey, in that present moment, we are open, we are curious, and we also accept because we don't judge them, but we accept them as they come to us, but with complete awareness. So, no judgment, but complete awareness. The historic part of it, of course, it started by Lord Buddha 2500 years ago. We say Lord Buddha, he's Buddha. He never asked us to believe in him as God, so let's call him Buddha, which means the enlightened one. So enlightened nature is in all of us. And he brought, although this is very ancient, even before Buddha, but he brought in practice mindfulness. And in early 70s rather, Thai Thich Nhat Hanh brought it to the West. And even Joan Kabat, Professor Joan Kabat, who came up with mindfulness-based cognitive therapy, is a student of Thai Thich Nhat Hanh, who is no more. So today, mindfulness has become a very big platform for research everywhere, and more we believe that if we are mindful, our focus increases, our concentration increases, our relationship increases, we become better human being, we become greater human being. That's enough research now, and is very powerful. So if we think about, for example, if we think about an iceberg, we only see the cap of it, the rest of, I don't know, in 10, 20 fold The rest of the iceberg is below the water. In the same way, our consciousness, our conscious mind, we only use 5% of the total consciousness, and 95% is used in the subconscious level, which helps us in autopiloting ourselves. So there are a lot of things learned in that, which brings us into greed, jealousy, anger, all the negative vibration, pride, of shame, guilt, and things like that. They are all stored in that. Now, if we remove those, like if we break the lower part of the ice, the upper part will begin to float more and more out. In the same way, our conscious mind will also begin to increase more and more. And this can only be done through the concept of mindfulness. When you are mindful, you become aware of what you hold and you accept that thing. Once you accept that thing, you take the next level. Once you accept that if someone is shouting on you, you are, because of some anger in him or her, you once you accept that the person is shouting at you, the next level you do is you try to understand the person because of your awareness, and you realize, without being reactive, you realize that the person is suffering, and the next stage you do is become empathic or compassionate towards that person. So you see, awareness helps us grow to become a better and a better human being all along in our lives system. So understanding happiness in our relationship, of course, the construct is based on trust, communication, empathy, and mutual respect. But let me come to this term love, because without love, nothing can happen. If you are kind without love, it's not kindness at all. It's kind of show business. In the same way, love for me is a foundation of our existence. Love for me stands for, as a abbreviation that tells me, live on values every day. Love, that's the abbreviation. I call that the foundation of life. On this love are four pillars, which I also have abbreviated as RICH, RICH, rich. R stands for relationship, I for integrity, C for compassion, and H for humanity. Let me try to explain each of these pillars. Once these four pillars are ready, standing on love, what happens is the roof automatically finds its place, which is belonging, which is trust, which is empathy, and everything is in there. So first pillar, relationship. We know that Harvard did 75-year-old long, study, longitudinal study, and what they found that it's the relationship that matters the most. If we had to look for one area of or one domain or one measure for happiness, so relationship is not just with others in terms of just being in like a parental relation, sibling relation, friends relation. It's beyond that. First relation is self with self. Without having the thoughts of the past or the future, you connect with your own inner self. The second is self with others, without any toxic of societal norms, values, cultures that we talk about that differentiates each other. The third is connection between self and the nature, because we know that if we look into nature, all genesis of nature are in us. So we know that we are the last species to be on this earth, and all that is there out there created us, whether it's animals, insects, amphibians, you name it. All the genes, human being genes, are in there. That's why we called of Panchabhuta, the five elements of planet Earth. I wish I had more time. I would talk and prove to you that we are all Bhagavan, and Bhagavan is in us, and Bhagavan is around us, and we are the Bhagavan. Anyway, so that's R. I is integrity. Integrity is not just conscience, right from wrong. It's beyond that. And that is when we begin to see things with non-dualistic perspective, when we see things as they are, then we understand the reality of our right or wrong. And when we are able to find right or wrong, we are also becoming careful, aware, we accept things as they come, we are willing to listen, and we are accepting, and we are realizing it. You know, after we realize it, of course, then our reactions, which becomes proaction, and we become much more in this space. The other one is compassion. Of course, compassion is one step ahead of empathy. Empathy is when you feel the pain and distress and difficulties of the other person in you, and you begin to suffer like that person. That's empathy. But compassion takes one step beyond. Empathy makes you understand the pain, and you don't bring the pain in you, but you begin to help other either through your mental construct, your mental visualization, sending loving kindness and so forth, or you go physically to help the person. Okay, so that's compassion. And humanity, we all know, it's about self and care, respect, the etiquette that we talk about. How do we behave with children? How do you behave with elders? How do you behave with others? How do you behave with your family members? That's where we come with humanity, with care, love, and all that we can think of, serving them and doing well. So if we can build love as the foundation, I don't think I have to talk more on how to create a better relation, but I have 8 slides, so let's continue. Benefits of mindfulness, there's enough research been done on this. There's a number of things. When you're mindful, your communication style improves. Now, there are 4 levels of communication. One is I in it, I in myself. I have reference in my mind. I will download everything that I know of the person. We take it for granted. I know this happens between wife and husband when they have crossed 20 years of living together. No one hears nobody, because when a husband says 2 words, wife will make the sentence, or when wife speaks 2 words, and all she might want is the husband to listen, but he has no patience because he takes for granted that I know my wife, and he starts downloading from his reference and starts speaking the volumes out, and which is not desirable at all, and we break into fight and our communication is missed. We can, of course, with mindfulness, we are very aware of every situation, and we respectfully we resolve our conflicts with one another. We are aware of ourselves, so we any emotion that arises in us, we also are able to regulate them. In the same way, we increase the empathy, because when we know someone is jealous of you or angry of you, or does something, tries to do something wrong onto you, you realize that you're better than that person. And what do you have for that person is more the empathy. Not that you get angry onto the person, but you increase your empathy towards that person, and you try to go out to become compassionate, to help the person go out of their own space to become better in the relationship that we carry. The next is mindful communication. We have to constantly learn to listen to others. Listening is a very, very difficult thing. And like I said, we have 4 types of communication. The second type is factual listening. We call I in it. So I begin to now listen. Then the third kind of listening is empathic listening, where I step into the shoe of the person. That's where the empathy comes from, into the shoe of the person and understand word by word what he or she is speaking. Then only I begin to be proactive towards it. So in this communication, we use mostly I. Did I hear you this way? So you repeat that person. Or I feel so deeply about the situation that you were in. So you're giving those kind of I messages to the person, which means that you have completely understood the person. And what is the fourth kind of listening? It will be regenerative listening. You'll be, both you and the relationship that you are with, you will be listening or seeing something really totally and a greater outcome, not your way, not my way, but everybody's, a third way, a higher way. All right. So the other one is, why is this things coming on my screen? Is empathy through mindfulness. Like, once we have the acceptance, once we know, mindfulness can cultivate and foster deeper understanding. Yes, first with the self, yourself. That's why we take a higher learnings in this. We come to the absolute truth. We learn the absolute reality in this, and also we learn, because once we know ourselves, then we know others. Because if we don't know ourselves, we should not think that we know others. So therefore, mindfulness helps you understand deeply more profoundly about your own self first before you can understand others. What do you practice to build this mindfulness is, sorry, what you practice to build this mindfulness is, like I said, loving kindness. Somebody asking something or
Participant, please mute yourself.
so so there are practices for this, of course, to cultivate empathy, and that can be through mindfulness, definitely. What you need to do is you need to send loving kindness. That's a meditation. You try and bring the person that you are wanting to bring a change in, or that you think the person is suffering, that you would like to be empathic of the person. Bring the person in the best possible form into your mind, and what you do is visualize that person completely the best way that you can visualize, and then send him or her a loving kindness message. Something like this: may you be happy and well. May you be free from fear and anxiety. May you be loved and cared. May you be respected. May you be always happy and well. May you be happy. May you bring happiness to the lives you touch. May you find happiness in whatever you do. This kind of messages, in whatever you want to change that person in, you can bring those messages through visualizing and speaking through your mind to the person. I promise you, you will reach to that person. The person will get your message, because simply because, on an average, not talking about Americans who have 50 trillion cells in them, they are much larger kind of people. But on a global average, we are 37.2 trillion cells. And you'll believe me that every average human being would have 50, almost 53 trillion volt of energy with us. And so when we concentrate, when we focus, we can reach that person, we can talk to that person very easily. Believe me, I do this in a far distant land and help others too. And then, of course, the perspective taking, exercise, which you need to not see from your values, from your culture side. You need to step out and see the perspective from others as well. For example, you show a picture to 10 people, you'll have 10 answers, maybe. If not 10, at least 6 different answers. Maybe the other 4 would be matching with some others. So our perspective, our look is totally dependent on the environment and the circumstances we grew. And our values, our cultures that have evolved over the time actually take stock into who we are. Our perspective are what brings us to be who we are actually. And when we take when you change our perspective, try to look through the lenses of other people, then we are able to see our perspective through a different lens, and we will be able to celebrate the difference with their family, with others, in this in problem or otherwise. So these are very beautiful techniques. There are many techniques, of course. As we run, I'll just quickly tell you some of them. So the conflict, we also can resolve our conflict with mindful practices. And for this technique to resolve our practice, all you need to learn is mindfulness techniques of breathing in deeply, like we began with. If you are very anxious, or somebody shouted on you and suddenly get angry, give that, the endowment universe has given. What are those endowments? They are your conscience, they are your awareness, they are your willingness, they are your memory. So try to hold on to them, and it's a fraction of second, like the AI does. Your mind will modulate everything and enable you to respond back. So there is no stimuli, and there is no crash of an action. You don't react onto the stimuli and break your relationship further. Rather, you take little time to take a deep breath, 1 or 2 deep breaths in, and then these reflections on these endowments will enable you to give a proper proactive reply. um, so you must learn to be present. So the quickest way to get out of any distress, any anxiousness or any worry is very, very simple. You just standing in a corridor or walking through the space or whatever you're doing, all you need to do is stand and take deep breaths in and out. And if it is really very troublesome, even addictions we just heard about, alcoholism or any kind of drug addictions can also be done away with breathing exercise. All you need to do is once that desire enters you, you just open your lungs and breathe in deeply and throw forcefully out of your mouth. 5 times, I tell you, the urge is gone. Your urge to, have alcohol or get into drugs will be going away. Just 5 times. But it's momentary, it'll come back to you. Do that same thing over 6 days. And I promise you, the moment the urge comes on the seventh day, just a breath will let you go away. But don't repeat again after that, because you will think, oh yes, I have learned the tactics of getting rid of my alcoholism or smoking. Now I can begin. No, if you do that, then you get into the treadmill. Then you'll bring more sufferance to yourself. So there are simple practices in doing this to remain present with yourself. Be aware, be conscious. Whatever you're doing, try and bring your focus. And through meditation, you can always bring this focus. Practice compassion, because when once you realize this, once you have the acceptance and the willingness, then you begin to realize is because when someone is angry on you, you should not react immediately. Take a deep breath and say, why is he angry? Question, willingness to listen, whatever comes to you, then you accept, then you begin to reason, why was he angry? And then you come to a reason suddenly to find the person is suffering. So you're no more angry, you're no more frustrated about the situation. Rather, you'll want to help that person. Okay, so you'll unlock your horns that has been stuck for years together through these practices. So the final one is nurturing your mindful relationship. How do you do that? Of course, your interactions with your loved ones has to be very, very mindful. And how do you bring this mindfulness in your walk of life? Is through your activities. Where even when you are, washing your pots or eating your fruit, keep your focus onto it. Washing your cup or drinking a cup of tea, washing your cup, feel how your hand is moving, how the soap slippery on the cup, how the water is flowing out. Be present in that. If you're eating, be present on the food. Thank the universe, thank the sun, the moon, the hard and loving work of the farmer. Thank everybody who's involved to bring that food onto your table. And with that, when you're thanking, you're connecting with all of this and you are being present. You're focusing on what you're doing. Your concentration is going to will rise into a higher level. So, and walking from one classroom to another or one room to another or anywhere in the space, when you begin to walk, what happens with the mindfulness? You feel that you're kissing your mother earth. Be grateful to the earth that has given you another day, 24 hours in front of you. Thank the earth, giving you a chance to live on it. A few 100,000 have not seen the rise of the sun, but we have. So we need to be grateful. Are you ever grateful to your clothes that you wear, to your shoes that you wear, or the pen that you write, or the computer that you use, or this media that we use? No, we take everything for granted. You know, uh, so we're never grateful to anything. Learn to be grateful, and you again begin to develop your relationship. You'll begin to love your mother more, your parents more, your siblings more, your friends more, your society more, and you become the love. At the end of the day, people will look at you a shining star among themselves. All right, so learn all this, and then you will find a journey out from all the darkness of our lives into more beautiful relationship of in the universe, of yourself and others and the nature. With this, I end Tashidelek. Tashidelek means I bring you all the auspiciousness. Thank you for giving me this opportunity to talk to you. But I won't let you go without singing this happiness song with me, because that's what I do with every class that I take. So I'll sing the first line and you just follow me. It's a beautiful, nourishing song. It's for the mind, not for the body. So I'll begin. Happiness is here and now. Please sing. I have dropped my worries. Please sing. Nowhere to go, nothing to do,
Nothing to do,
and I'm
and
not in a hurry.
happiness
Happiness is here and
here
now.
and now.
Happiness
Happiness
is
is
here
here
and now.
now.
I have dropped my worry.
I have
I
dropped
have
my
drawn
worries.
my
My
worry.
worries,
Somewhere to
To
go,
Oh,
something to do,
something to
thing
do.
to do,
this
but
I'm
I'm
not
Something
in
to do,
a
not
but I'm
in
hurry.
a
not in a
hurry.
hurry.
But I'm not in a hurry.
Thank you so much. Thank you for your time. Thank
Thank
you.
you, thank you.
Thank
Thank you
you.
so much,
Yes,
sir, for
ma'am.
a wonderful deliberation, wonderful lecture. It's always
Thank,
a delight to listen you. Thank you so
you.
much, sir.
Thank you. Bye
You have
bye. I
given
have another lecture
so
lined
Thank you
up.
so
valuable tips also.
So I'll have to leave
Thank
soon.
you.
I have another lecture. Some
Thank
students
you.
from another university have come. So they are up in the hall. I have to rush up. So thank you so much. My
Thank
love,
you.
and I wish you all the successes in your life. May you be happy and well. May you find happiness in whatever you do. May you be the shining star of your family, your friends, your community, and the world. Thank you so much. Bye bye.
Thank
Thank
you.
you
Bye
so much,
bye.
sir.
Thank you. Thank you so much.
Thank you so much, sir. So now, in the capacity of HR Speaking Cube and on the behalf of Speaking Cube, I would like to extend my warm vote of thanks to Dr. Rajkiran Dontu for his wonderful talk on childhood trauma and psychiatric illness, and then Dr. Anita Chauhan for her wonderful talk on psychological perspective of happy couple relationship, and then Professor Dr. Lobsang Bhutia for his kind words on self-love through meditation. And then Professor Dr. Devendra Singh Rana for his insightful words on impact of alcohol dependence on happy relationship. Then not last but not the least, Professor Dr. Samru Chetri for his insightful words on role of mindfulness for peaceful relationship and precious time. Now the session comes to a break, and we will start the scientific session sharp at 2. And the same link will be active for valedictory ceremony, which will be starting at 3 p.m. sharp, where people will be facilitated by our Congress spokesperson. So please be there, and attendance will be taken.
I request everybody to be there in the valedictory session, right? And let's end the conference with a big bang, right? So thank you everybody for your patient listening and for
Thank
you
you
to
so
be
much.
there and present. Bye everyone. Let's meet at 3
Thank
on
you,
the
ma'am.
same link.
Thank you, ma'am.
Thank you, ma'am. Um,
Requesting everybody to please leave the link and please join the same link at 2:45 p.m. for valedictory.